Hi, and welcome to this introduction for the FM Pivot course. My name is Dr. Clayton Dyck, and I am the Medical Education and Training Lead for the Besserer Center for Global Family Medicine. During this introductory video, I plan to tell you a bit about who we are within the Besserer Center and within FM Pivot. I plan to tell you a bit about the origins of FM Pivot and why we are producing this initiative. And finally, I plan to spend most of this 15-minute presentation telling you a bit about the FM Pivot course itself. The Besserer Center is a division of the College of Family Physicians of Canada. We were established in 2014 and are based in Toronto, Canada. The center is regarded as a hub of international collaboration, and we are dedicated to advancing family medicine and primary care provision globally through education and training, building worldwide relationships, and fostering research. Presently, we have a membership of approximately 37 countries, and we have multiple international stakeholder relationships as well. Within the education and training arm, we advance medical education and training through the support of development of family medicine academic programs, particularly those in lower and middle income countries, through the improvement of training of family physicians and generalist physicians, and through the strengthening of the teaching capacity of existing family medicine programs. Our FM Pivot development team is comprised of family physicians and educators who represent 6 Besserer partner countries. They are listed here in the table. And we receive support through the Besserer Center and the College of Family Physicians of Canada. So why FM Pivot? As with many initiatives that have been developed in the past year, it started with COVID-19. As primary caregivers and family physicians, we all are aware of the enormous impact that COVID-19 has had on the care of our patients and of their health outcomes. We like to conceptualize this in a series of 4 waves, as illustrated in this infographic. These waves are different than the waves that we describe when we talk about disease incidence, such as the first, second, and third wave of the pandemic. These are more related to different kinds of health outcomes. The first wave describes the impact that COVID-19 or other global health emergencies might have on the morbidity and mortality of our patients directly. Certainly, we have been experiencing that in the past year. The second wave refers to the impact that COVID-19 might have on the delayed presentation, diagnosis, and treatment of urgent non-COVID conditions. And certainly we have seen that as well. The third wave refers to the impact that happens on the interrupted care of chronic conditions, such as diabetes, congestive heart failure, say, COPD, and so on. Finally, there is a fourth wave that we are becoming increasingly affected by, and that is the impact on mental health. Not only on our patients who have pre-existing medical conditions, pre-existing mental health conditions, but also the broader patient population in general. When we look at how we as primary caregivers and family physicians deal with these types of impacts, it's helpful to think of the concept of resilience. And we feel that this infographic illustrates the concept of resilience quite nicely. In the face of a shock that comes with a global health emergency or disruption, it's very important to ensure that you have decreased vulnerability in the face of it. What this means is there infrastructure in place, already in place to handle this emergency, such as, do you have enough healthcare providers? Are they adequately trained? Is there enough equipment and supplies available to deal with that particular pandemic? Is there a process already in place within broader healthcare systems to deal with the disease? But more interestingly, resilience also refers to having the capacity and the ability to make improved choices and capitalize on opportunities during the global health emergency, so that when you are in the thick of what is happening, you're able to nimbly respond, so that you're able to not only recover to a pre-event state in terms of health outcomes, but perhaps even better than before, and perhaps even reach a stage where you have transformed your healthcare system, causing transformed health outcomes as well. So actually things can end up being better in some regards than it was before. We've actually seen that in the face of some global health emergencies in some communities and contexts. And when we look at this concept of resilience, it is really an important part of the role of the community-based primary caregiver or family physician. We were able to capture some of this through our CFP podcast series that we co-produced with the Canadian Family Physician Journal. This series was hosted by Dr. Christine Gibson, and she had the opportunity to interview 10 different family physicians within the BESWR community from around the world to go over what their experience of COVID was and what kind of responses and adaptations they have had to make in the face of the pandemic. This series was produced in the first few months of the pandemic, and what we came to realize was that there was incredible innovation and different kinds of things that we could learn from each other that perhaps we in Canada hadn't thought about from one of our global partners, or one of our global partners maybe hadn't considered coming from Canada or another country context. So we started to think, how can we apply what we've learned from COVID-19 in the face of the next global health emergency? So questions that came to mind were, what are the common lessons learned that we've had regarding the impacts on our patients and their communities? What about on our approaches to care and our approaches to medical education and training? What are our roles as family physicians within our community? What are the approaches that we can take or change for research and the provision of evidence-based care? And what are the impacts that have happened on our own personal lives and our own mental health? Bigger questions came to arise about how we can be better prepared to adapt nimbly during future global health emergencies. And how can we actually leverage these emergencies to transform our practices to improve our health outcomes? In short, how can we build resilience? This is where FM Pivot comes in. We hope that this initiative will improve the resilience of your health system through building capacity of community-based family physicians and primary caregivers, through capitalizing on our center's global reach and emphasis on co-learning between global family physicians, and finally, through providing opportunities for for education, sharing, dialogue, and collaboration. What is FM Pivot? We hope that what we've developed is an online, open access educational resource that is thematically based, easily accessible, relevant to community family physicians and primary caregivers in multiple global contexts, competency-focused, evidence-based, and collaboratively developed, representing global perspectives. We are planning to have 3 components of the initiative. The primary one that we're working on right now is educational products, and I'll discuss that in further detail later. We also are planning to have an interactive platform for discussion. And finally, a repository for sharing of resources and dissemination of knowledge. And as you are probably aware, having had access to this video, we are planning to have this accessible through the World Health Organization's Integrated Care for People site. The address for this website is given here. For the remainder of this presentation, I plan to talk about the FM Pivot course. The overarching objectives of this course are that upon completion of the FM Pivot modules, we hope that you'll be able to better apply your unique competencies as community-based family physicians and educators to prepare your practice of care, your educational activities, and/or your local health system to ensure quality health provision is given within all 4 waves of a global health disruption. We hope you'll be able to more nimbly develop and adapt approaches to health provision and medical education when such disruptions arise. We hope you'll be able to capitalize on new opportunities for innovation and research as they arise. And finally, we're hoping that you'll be able to evaluate and improve the above activities as needed when the cycle of disruption has completed. The FM Pivot course is developed primarily for community-level family physicians and primary caregivers, particularly those who are based in lower and middle-income contexts. As well, though, we are hoping that the course can be used by family medicine trainees and as well by family medicine educators, both at the postgraduate medical education level and at the CME and CPD level. Our plan is to have a series of 5 modules developed by the end of this year and launched by the end of this year. We are hoping to release these modules every 2 to 3 months, starting in May or June of this year. Within each of these 5 modules, there will be 5 themes, and within the themes, there will be specific, more granular topics. We will be having these modules, as you know, organized on the LearnDash learning platform. Each of these modules we plan to have organized so that it takes approximately 2 to 3 hours to complete. And upon completion of each module, you will receive a certificate of participation. We've developed these modules to incorporate multiple global perspectives from practicing family physicians around the world, particularly, again, those from lower and middle income contexts, and as well from family physicians based in Canada. We hope to draw the content from recent medical literature, as well as narratives and experience from global partners. Excitingly, we are also hoping to draw from your ongoing input through what I will describe later as Zoom coffee chats and discussion boards. These are the 5 themes for the modules that we are presently working on. Our first module that is being launched in May or June of this year is broadly focused on community-based research. It's developed by Drs. Adelson Jantz of Rio, Brazil, and Dr. Sumit Sodhi of Toronto, Canada. More specifically, there has been a particular interest amongst community-based family physicians to participate in research because of the COVID outbreak. And so our developers have developed a module specifically looking at formulating high-quality research questions for new and novice family physician researchers. We're quite excited about what we are producing right now and look forward to your input. The other topics that we'll be introducing in modules later this year are focused on chronic disease management, emergency response and planning, mental health, and virtual education and curriculum adaptation. This is the module format. It will be comprised of a participant pre-assessment, followed by a series of asynchronous video presentations and text content. We will be including key references and resources for you to review. And importantly, we will be incorporating self-learning exercises, which will be designed to help you reflect and apply what you've learned in your own context. We are also planning to have 1 or 2 live Zoom group coffee chats scheduled approximately within a month of the module launch, where you can spend live time with the module developers to have your questions answered and to share your own ideas as they relate to that particular module. We will also have a link to an online discussion board that you'll be able to access for questions asynchronously and for sharing your ideas and experience with other participants and learners in this module. Finally, you will be asked to complete a post-assessment and module evaluation. After completing all the module activities and submitting your module evaluation, you will be provided with a certificate of completion of that particular module. As you are viewing this video, I believe that you know how to get onto the LearnDash site and to view the course. But for those of you who have accessed this in a different way, further details should be available on the Besserer Center's IC4P site. As well, if there are any concerns about access through IC4P, we will be posting further information on the College of Family Physicians Besserer site as well. However, we plan to use IC4P as our primary portal. There may be a brief login registration required for IC4P, but it should be fairly straightforward. So finally, your feedback is invaluable as we move forward. Certainly, development of these modules is an iterative process, and we will be applying your feedback to the formatting and the content of subsequent modules as we move forward over the year. So please be honest and detailed in your evaluations. We really appreciate that input. So what's next for FM Pivot after 2021? Well, we plan to do a full review after the first 5 modules are completed, wherein we'll be looking at your feedback and as well reviewing using an evaluative framework that we have completed. We are certainly considering development of further modules which will expand or add on to the original series. One example of this is from our research leads who would be interested in having another module that your research questions that you may have developed to look at how you can actually prepare your research project in anticipation of a global health emergency. We are also looking at having modules that are in French or translated to French, and as well as other languages if there is interest. We are interested in developing a concept called FM Pivot Plus, which is the development of enhanced educational activities, which will be tailored to specific contents or programs for an additional cost. And finally, most certainly, we are looking at collaborations with other educational organizations. So if you are an educational organization out there that is interested in collaborating with us, please feel free to contact us. So that's the overview of FM Pivot. I hope that you found what we've presented to be of interest to you and will entice you to participate in the learning modules. We most certainly, again, look forward to your questions and feedback. My email address is given here as cdyck@cfpc.ca. Thank you very much, and I look forward to working with you on the course.